Right now, inside your chest, something is beating. It has been beating since before you were born. It beats when you sleep. It beats when you run. It beats when you are scared, when you laugh, when you cry. It has never once taken a day off. That is your heart. And right now, in hospitals all over the world, doctors are saving hearts using something so small. You could balance it on the tip of your finger. It is called a stent, and most people have no idea what it actually is. They hear the word, they nod, and they walk away with a tiny metal ring sitting inside their heart, and they couldn't tell you how it got there, what it does, or why their life depends on it. Today, we fix that. I am going to take you inside the heart. We are going to follow that tiny ring on its journey through your body. And by the end of this, you will understand something that most adults, and even some doctors, never fully explain out loud. Stay with me. Section 1. Your heart is a pump, and it needs its own water supply. Let's start simple. Your heart is a pump. Its one job, its only job, is to push blood around your body, to your brain, to your lungs, to your fingers and toes, to every single cell in your body that needs oxygen to stay alive. Now here is the part most people don't think about. The heart is a muscle, and muscles need blood too. So your heart has its own private set of pipes, tiny tubes that wrap around the outside of it like little rivers, delivering fresh blood directly to the heart muscle itself. These pipes are called coronary arteries. Think of them like the garden hose that waters the garden. If the hose is wide open, water flows. The garden stays alive. Everything is green and healthy. But what if something starts blocking that hose? Not all at once. Slowly. A little bit today, a little more tomorrow. Over months, over years. And here is the scary part. You cannot feel it happening. You feel completely fine. You breathe fine. You walk fine. You sleep fine. But deep inside those tiny pipes around your heart, something has been building. Section 2. The sticky stuff inside your pipes. Imagine your kitchen sink pipe. When it is new, water flies through it. Clean, fast, easy. But over time, grease goes down the drain. Soap builds up. Little bits of food stick to the walls. Slowly, the pipe gets narrower, then one day, blocked. The same thing can happen inside the pipes of your heart. But instead of grease and soap, the sticky stuff building up is made of fat, cholesterol, and other things floating in your blood. Over many years, this gunk sticks to the inside wall of the coronary artery and hardens. Doctors call this buildup a plaque. Now here is the part that will surprise you. This plaque does not sit in the middle of the pipe like a clog. It grows inside the wall, like a blister underneath the surface of the skin. The pipe still looks open. Blood still moves through, which is exactly why you feel perfectly fine. But underneath that wall, the blister is growing. And one day, just like a blister that gets too full, it can pop. When it pops, your body panics. It thinks something is torn and bleeding, so it sends tiny emergency workers, called platelets. They pile on top of each other, trying to seal the tear. In minutes, a clot forms, and that clot blocks the pipe completely. No blood gets through to the heart muscle, no oxygen. The heart muscle starts to die. That is a heart attack. And that, right there, is why the stent exists. Section 3. The doctor's decision. When someone arrives at the hospital with a heart attack, every single minute matters. Here is a phrase that cardiologists, heart doctors, repeat to each other constantly. Time is muscle. Every minute the pipe stays blocked, more of the heart muscle dies. Not resting, not waiting, dying. This is why heart attack teams in hospitals move so fast. There are no long forms to fill out. The patient goes straight to a special room called the Catheterization Lab, and the doctor gets to work immediately. The goal is to open that blocked pipe as fast as possible, and the tool they use is the stent. But before the stent goes in, the doctor has to do something incredibly brave. They have to send a tiny wire into your body, from your wrist, all the way up your arm, through your chest, and into the tiny pipe around your heart, without cutting you open, without you being asleep. Let me show you exactly how they do it. You are lying on a table. The room is cool and bright. There is a big machine above you that takes pictures using X-rays. Like the pictures they take at the dentist, but of the inside of your chest. The doctor numbs a small spot on your wrist, right at the pulse point, that place where you can feel your heartbeat with your fingers. They make a tiny hole, smaller than a pencil tip, into the artery in your wrist. Then they slide in a thin, flexible tube. like a tiny straw. This is the doorway into your body. Now through that tiny straw, they thread a wire. This wire is thinner than a strand of spaghetti. It is flexible enough to bend around corners, and it has a small curved tip that the doctor can steer like a remote control car by gently spinning it with their fingers at the wrist end. On the X-ray screen, the doctor can see this wire as a bright, glowing line. They guide it up through the artery in your arm, around the curve at your shoulder, through the big pipe in the center of your chest, your aorta, which is as wide as a garden hose, then down to the very bottom of the aorta where the coronary arteries begin. And then, carefully, patiently, they steer that wire into the tiny coronary artery, the pipe that is blocked. The wire crosses the blockage. The doctor can see it on the screen. The wire tip is now on the other side of the clog. The path is open. Now comes the part everyone should understand. Section 5. The balloon. Think of a long, thin balloon, the kind a clown uses to twist into animal shapes at a birthday party. Now imagine it deflated, flat, wrapped tightly around a thin stick. That is what a balloon catheter looks like before it is used. The doctor slides this balloon catheter over the wire, like threading a bead onto a string, and guides it to the exact spot where the blockage is. Once it is there, they inflate it. The balloon expands inside the artery. It pushes the plaque, that hardened, sticky buildup, against the walls. It opens the pipe. Blood starts moving through again. But here's the problem. As soon as the balloon deflates and comes back out, the pipe wants to close back up. The walls are soft. They spring back inward, like squeezing a rubber tube and letting go. The pipe is open for a moment, but it won't stay open on its own. This is exactly why the stent was invented. Section 6. The stent. A tiny metal spring for your artery. Imagine a small tube made of tiny metal rings all linked together, like a miniature piece of chain link fence rolled into a cylinder. That is a stent. Before it goes in, it is squished down tightly onto the balloon. Compressed, small, barely visible. When the balloon inflates, the stent expands with it. The little metal rings open outward. They lock into their new, wider shape. Then the balloon deflates and slides back out. The stent stays. It is permanently holding the artery open from the inside, like a tiny scaffolding inside a tunnel, keeping the walls from collapsing. The pipe is open. The blood flows. The heart muscle gets its oxygen back. And the person lying on the table? Most of them feel the difference almost immediately. That crushing, tight pressure in the chest, the feeling like an elephant is sitting on your ribs, begins to fade because the pipe is open, because the heart is fed. Here is where it gets interesting. Your body is incredibly smart, but it does not understand what a stent is. It has no category for helpful metal ring a doctor put in on purpose. All it knows is, there is a foreign object inside my artery. So it responds the way it always responds to something foreign inside the body. It attacks it. Tiny emergency workers, platelets, rush to the stent and start trying to cover it. This is the same thing your body does when you get a cut. It sends clotting agents to seal the wound. The problem is, if a clot forms inside the stent, the pipe gets blocked all over again, immediately. And a blockage inside a stent is extremely dangerous. It can cause another heart attack within hours. This is why, without fail, every single person who receives a stent must take special blood-thinning medicine every single day. Usually 2 medicines together. Aspirin is one. Another medicine blocks the platelet workers from piling up inside the stent. Stopping these medicines too early, even if you feel perfectly fine, is one of the most dangerous mistakes a stent patient can make. The doctor is not being overcautious. The biology is real. The risk is real. The medicine keeps the tiny pipe open, while the body slowly learns to accept its new neighbor. Section 8. The stent gets a coating, and it changes everything. Now here is the next chapter in this story. The first stents were bare metal, just the ring, nothing else. They worked beautifully at first. The pipe stayed open, the clot was gone. But over the following months, a new problem appeared. The body, still not fully trusting this foreign object, sent in another repair crew. Smooth muscle cells from the artery wall. They multiplied. They grew into the space inside the stent, like vines growing through a fence. The pipe started to narrow again, from the inside of the stent this time. In about 1 out of every 4 or 5 patients with these early stents, the artery would close back up within 6 months. Doctors called this restenosis, the narrowing coming back. So engineers did something brilliant. They coated the stent in medicine. Not just any medicine, a very specific drug that tells cells to stop multiplying, stop growing, stay where you are. The coating releases this drug slowly, like a time release capsule. over weeks and months, just enough to keep those smooth muscle cells from overgrowing inside the stent. These are called drug-eluting stents, and they changed the game completely. With drug-eluting stents, the rate of restenosis dropped from roughly 1 in 4 patients to fewer than 1 in 20. That is the difference between a procedure that buys you 6 months and one that buys you decades. Section 9. Going home. What recovery really means. The procedure is done. The stent is in place. The X-ray shows blood moving freely through the artery. Fast, bright, clean. Most patients go home within 1 to 2 days, and they feel different, better, sometimes dramatically better. The chest pain that had been building for hours or days is gone. Breathing feels easier. Walking to the bathroom doesn't feel like climbing a mountain. But here is what every cardiologist will tell you, and what every stent patient needs to understand. The stent fixed the pipe that was blocked. It did not fix the reason the pipe got blocked in the first place. The same slow buildup of plaque in artery walls is still happening in other pipes. The environment that caused the original blockage, the inflammation, the cholesterol, the blood pressure, the blood sugar, is still present. This is why the medicine prescribed after a stent is not optional. Statins, cholesterol medicine, do not just lower numbers on a blood test. Research published in major medical journals has found that they actually make existing plaques more stable, less likely to rupture, less likely to trigger another heart attack. Blood pressure medicine keeps the walls of those arteries from being battered. Stopping smoking reduces heart risk significantly. Cardiac rehabilitation reduces the chance of dying from heart disease. These are not suggestions. They are the second half of the treatment. Section 10. The bigger picture. The first stent was placed in 1986. Today, patients can have a blocked artery opened in under 90 minutes. But the stent is a response. The disease began years before. A major study found that stents do not prevent future heart attacks in stable patients. Stents save lives in emergencies. But prevention happens earlier. From onward, the stent was invented,